Hello, everyone. Thank you for being here. If you are here with us today, you are here to know more about the Opioid Settlement Funds, the local perspective. And with us today, along with our featured speaker, we have Marianne Huff, who is the CEO and president of MHAM. Before we kick things off, just want to let you know if you're here and you need CE for McBath or social work, please drop your full name in the chat so I can make sure that you're here. And after this webinar is done, everyone will receive a copy of Amy's presentation along with a general survey for you to just tell us how we're doing with all of our educational content, as well as a CE for those who need McBath and social work. So we're going to kick this off. Marianne, it's all yours.
Great, thanks. Hi, everybody. Thanks for joining us this afternoon. This is a pretty important webinar in our mind because of the, well, now it's up to $1.6 billion opioid settlement. And we're really glad that you're here so you can learn more. I'd like to introduce our speaker, Amy Dolinky. Amy joined Michigan Association of Counties in 2022 as the technical advisor, Opioid Settlement Funds Planning and Capacity Building. Prior to joining MAC, she served as a senior program manager, overdose data to action with the CDC Foundation, and as a senior advisor of Michigan's opioid strategy with the Michigan Department of Health and Human Services. Previously, Amy served as the substance misuse response coordinator, leading strategic planning around substance use with Knox County government in the state of Tennessee. She holds a master's degree in public policy and administration with a focus on global health from Northwestern University and a bachelor's degree in criminal justice from Loyola University, New Orleans. And she's going to be talking about the opioid settlement from, as Kristen indicated, from the local perspective. So I want to welcome Amy.
Thank you so much. Really appreciate the opportunity to be here. Apologies in advance to everyone for not being able to be on camera today. I'm having some medical issues, but I will get started here by sharing my screen. So please let me know if there's any issues with viewing the presentation. And I do have time at the end of the presentation for Q&A, but would love to hear any questions that come up throughout the presentation. This is pretty dense material, and for anyone that has tried to get a gauge on opioid settlements, it takes a bit of time and it's constantly changing. So please feel free to ask questions throughout. So I'll start with kind of what the opioid settlements are. So we have settlements for alleged harms caused by opioid manufacturers, distributors, and pharmacies all across the country. And we see some settlements where payments are already going out, some settlements where we know the anticipated payments, and some that are still in kind of that lawsuit or bankruptcy process. So the money from these settlements will go to the state of Michigan as well as to local governments in Michigan. So that would be townships, cities, and counties if they are eligible based on the requirements of that settlement. There are also separate tribal settlements, but what we see across the country is many states really focusing some of their state opioid settlement funds for tribal governments. Right now in Michigan, we're expected to see about $1.6 billion come into the state, with approximately 50% of those dollars going to state government and 50% going to local governments. We'll get into each of the kind of primary settlements that we're talking about, but for most it is that 50-50 split. Now, while most of us function on either a calendar year or a fiscal year, the companies that we're settling with are not functioning in that kind of format. And so what we see is a focus on the maximum number of payments, as these companies do not necessarily need to pay every year, or they can pay multiple years at one time. So this is just a bit of a breakdown of the maximum number of payments associated with each settlement. But overall, we're anticipating seeing funds come into the state of Michigan over an 18-year period. and the initial payments to local governments started coming in on January 31st of 2023. Now, there's 3 pieces of legislation that are key in the opioid settlement space. So most of these impact the state dollars, but one does impact really everyone in Michigan. So the first Senate Bill 993 established the Opioid Healing and Recovery Fund. So this is a specific fund within the state government that ensures how state settlement funds are utilized, reported on, and really creates an opportunity for those funds to be secure in making sure that they don't move into general fund, as well as providing a space where we can highlight what those allowable uses are and they're required to be used in that way. Then we have the Opioid Advisory Commission that was established as well through Senate Bill 994. And that was to create really an oversight committee to really look at what's going on in Michigan in terms of behavioral health in general, as well as providing recommendations to the legislature specifically. Those recommendations are also shared with the governor's office, some state departments. The commission is not a decision-making body. They are an advisory commission, so purely in that advisory role. And then we have the last piece of legislation here. In order to get the maximum amount of funds from these settlements, it was required that there was a bar set in place to basically stop any future civil lawsuits against those companies for the opioids. So this is a really big piece that really impacts everyone in the state of Michigan, and something that everyone should absolutely be aware of. Now, there are other requirements in the settlements, things like working with the MAP system for prescriptions and things that those companies agreed to do and agreed not to do moving forward. But in Michigan, the key document is really the state subdivision agreement. So this document was created by the Michigan Attorney General's office in partnership with the local government council. So it's a group of attorneys that represent at minimum 70% of the county and local governments in Michigan. And they had to determine what they could agree upon in order to move forward with those settlements. So from this state subdivision agreement is where we were able to make changes from what the national settlements kind of suggested or outlined as a possible way to split those dollars and things that would come into play. And this is how we really figured out what the settlements look like in Michigan, and where we see Michigan really differ from other states around the country. Most states are really doing this differently. So the Michigan State Subdivision Agreement, again, determines how much of the money goes to the state and how much goes to the locals. It also allows for allocation adjustments. There is an allocation model that I'll walk through in a little bit, but it basically outlines how each local government, how much money they're getting, how that was determined. And then we do see that for some local governments, we see this with townships and cities a lot, that they'll receive their money up front if they were going to receive $7,500 or less. And then the state subdivision agreement also provides an opportunity, or did provide an opportunity for local governments to apply for a special circumstance fund. So this would be additional dollars if they felt that the allocation did not align with what was going on in their community. So if their community had an overdose event that maybe was outside of alignment, or if there were disproportionate rates of overdose that maybe weren't calculated into that amount, folks did have an opportunity to apply for additional funds. It also allows for local governments to combine their funds without really taking on much of an administrative burden. So local dollars do not flow through the state of Michigan. They go directly from the companies that are settling into an escrow account with a company called Brown Greer. And Brown Greer is functioning as the national administrator. So they are responsible for distributing those funds and responsible for housing some of the information that is reported back to them. And when we look at the way that these funds are flowing into local governments, we have to really look at how the numbers were determined. And so for the allocation percentages, we saw 3 items that were considered. This is national, right? This aligns with the national settlements, not Michigan specific. So it was the amount of opioids that had been prescribed in that area, overdose fatalities specific to that county, and then the number of people with a diagnosis of substance use disorder. So really looking at prevalence. And then again, those companies do not necessarily need to pay every year. They are able to skip 1 year of payments at a time. They just can't skip consecutive years, but they can do that at numerous points. And then when local communities are receiving dollars, we can expect to see a different amount coming in every year. So there may be pretty large discrepancies from time to time, which makes budgeting for these dollars much more complicated, especially when most governments are looking to determine how to fund programs sustainably. So I wanted to provide a little bit more of a breakdown of what we have at the state level before I jump into the local perspective. And so I mentioned the Opioid Advisory Commission. So that commission has 12 voting members. They also have a subcommittee, which is the Community Engagement and Planning Collaborative. And that is a group of stakeholders from around the state that have community engagement experience, health equity experience, and a group that is intended to advise the Opioid Advisory Commission. On the executive side, we have the Opioids Task Force, which was created by executive order, and that was done in 2019. And so this group was not necessarily related to opioid settlements at all. It was really focused on guiding the state strategy to address opioids in general. But in 2022, the group was expanded from state employees to state employees and 1 member from each prepaid inpatient health plan region to ensure local representation, specifically for the purposes of recommendations for the Mallinckrodt Settlement Funds. And we'll get into the Mallinckrodt settlement in a bit, but some of the bankruptcy settlements do have a government participation mechanism, which really is a board of individuals that consists of both state government and local representation. So the Opioid Advisory Commission, they do have open monthly meetings for folks that are looking for more information. And they do have a lot of reports and information available on their website. So just wanted to provide you all with more information. There's a resources slide at the end of today's presentation that will provide some additional places for you to seek more information also. The Opioid Advisory Commission currently is engaged in a real focus on listening to members of the public from across the state. So they have a survey that opened back in October and does not have an end date. So they plan on consistently gathering information from where the public feels that these dollars should be spent. And they also have listening sessions, both virtually and in person. And those listening sessions are really intended for them to hear from folks in the community on their experiences, barriers they're seeing, gaps and needs as well. The task force also has open meetings, but those are in person, whereas the OACs are virtual. And they, again, are really focused on the overarching state strategy to address opioids. as well as recommendations for that Mallinckrodt settlement. So I'll jump into the settlement specifics. Now, the two settlements you've probably heard most about are J&J and distributors, since those were the first two that local governments have received dollars for. Now, when we look at J&J and distributors, as well as the pharmacy settlements, so we have CVS, Allergan, Teva, Walmart, and Walgreens, those settlements all have the same allowable uses and the same reporting requirements. But it's really important to remember that each of these settlements that we talk about are distinct, and they are not all lumped together, which means that at any point a new settlement is coming in, it may have different allowable uses or reporting requirements. So the spending requirements for these settlements specifically are to align 85% of those funds being used for opioid remediation. And this is specifically the legal definition of opioid remediation. And then there's also alignment required with Exhibit E, which is a document that outlines what those allowable uses are. And I'll get into both of those items in a minute here. But we do also see that 70% of the 85% to be used for opioid remediation has to be used for future opioid remediation. So that doesn't mean prevention, it just means activities that have not yet taken place. And so when we look at what can be done with that 15% within the 85%, it's really reimbursement. So if the local government had conducted some work that aligned with the definition of opioid remediation, they would be able to reimburse themselves. But 15% again has no requirements for use. So here's the legal definition of opioid remediation, but I really want to draw your attention to point number 2, treat or mitigate opioid use or related disorders. So what this allows for is addressing polysubstance use as well as co-occurring disorders, which I think are two of the most critical pieces when we talk about the settlement, because it's so important that we're thinking long-term, and with a changing drug environment and recognition that in 18 years, so much has changed the last 18 years, and we can expect, many more changes in the coming years. So I think that's a key piece, and one that I know that county governments especially are paying attention to. Now, the reporting requirements for those specific settlements that we just spoke about, they are to report to Brown Greer, that national administrator again, every 6 months on any expenditures that do not align with the definition of opioid remediation. So I think the common example is probably filling potholes. So they do have 15% of those funds, which are unrestricted. So if they did use that to fill potholes, let's say, they would just have to report that information to Brown Greer. And then that information is actually shared on a website that is already up and running. Currently, there are no reports that have come in from Michigan. And I think part of that is we see a lot of local governments committing 100% of their funds to opioid remediation. But that's not to say that that's the case for everyone. We know that most local governments have not yet spent their money as well. So that's the only legal requirement for reporting in Michigan. Now, because there's a lot of unknowns, and because, I think all of us have an interest in understanding where dollars are going, whether that's to help other local governments figure out where to spend their dollars, or just for an understanding of effectiveness of these funds. The Michigan Association of Counties within the next few weeks will be rolling out our annual survey. This will be the first one, and that survey will try to capture information around planning efforts associated with settlement funds, as well as some expenditures. So we're not looking at specific expenditures, but really trying to figure out where are folks targeting their dollars: prevention, harm reduction, treatment, recovery, or things that are outlined in Exhibit E. That information will then be housed on MAC's dashboard, which I will highlight in a future slide for you as well. So when we look at the additional settlements, we do see a settlement from Meyer that went to 4 counties and I think 6 cities and maybe a couple townships. So that was not a national settlement. We also see another settlement from another pharmacy company that went to a few counties. Again, a non-national settlement. But the ones that I've outlined for you here, we have the Mallinckrodt settlement. So this has gone to the state government as well as only 5 county governments. Those are the 5 highest populated counties in the state. So they'll receive a direct distribution of funds. The rest of those dollars that are going to the state, 70% of those have to be reallocated back into the community. And so that's where we see the task force come into play as they determine where in each community do they want to bring those dollars. Now, we do anticipate many more settlements coming. So we expect to see dollars from Purdue Pharma, from Endo, from Kroger, potentially Rite Aid. We may see additional ones come up in the future as well. And then we have two settlements that only went to the state of Michigan with no requirement to redistribute back into the community. And that would be McKinsey and Publicis. So both of those are with the state, and they were single-year payments. Now, for all of these, we're looking at potential different allowable uses, potentially different reporting requirements. And with Mallinckrodt, we absolutely see different reporting requirements, and we may not see all of the funds there because of a second bankruptcy that they filed as well. So I also really want to highlight what Johns Hopkins put together. So they pulled together resources, experts from all over the country to be able to look at what principles should guide spending to really make sure that these dollars do not fall into some of the issues that occurred with the tobacco settlements. And so through that process, they were able to determine the 5 principles that you see at the bottom here. So I'll talk through those a little bit. So spending money to save lives. So the first thing that we think about here is that separate fund creation. So most counties have created a separate fund, the same way that we think about the Healing and Recovery Fund at the state level, to really ensure those funds are not moving into general fund and that they're aligning with those allowable uses. Using evidence to guide spending, really focusing on evidence-based practices, but we know that evidence-based in one area of the country or one city or one town does not necessarily translate to evidence-based in another area. So looking at data-driven solutions, these dollars do allow for a lot of innovation and are far more flexible than federal funds. And so I think we'll see different forms of evidence being used here. Focus on youth prevention, of course, and ensuring that those youth prevention strategies are evidence-based is a key point. Focusing on racial equity, of course, here in Michigan, we have disproportionate rates of overdose and non-fatal overdose that we really need to be focusing on how to best address. And then developing a fair and transparent process. Now, this is really about ensuring that the community is somehow brought into this conversation. So whether that's creating a website on a county website, whether that is making sure that we're bringing stakeholders and individuals with lived experience to the table in planning, a lot of different ways that we can do that. And most counties have created a steering committee of local experts to really provide the basis of data and recommendations as the boards of commissioners will be making those decisions. So a group to provide recommendations and data-driven solutions has been kind of the key focus of most communities at this time. So I'll talk a little bit about my role. My role, again, started in 2022 and is a short-term role that's really focused on process and providing technical assistance to any county that wants support. So through this process, we've been able to provide a lot of different types of support, and counties can really ask for anything at all. So some counties need administrative support, while others need facilitation support, strategic planning, analysis of spend plans. It really looks different everywhere. There are no two counties using these settlements or planning for these settlements in the same way. There's also about 12 or 13 other free technical assistance providers to local governments. So if it's support that is not a part of my expertise, or there's a group that may have more capacity, since I'm the only one at MAC providing this support, then we're able to make a referral to receive some of that additional help. So I would say the most utilized support has been with Michigan State University. They have a contract through the Michigan Department of Health and Human Services to provide support for community assessment and needs assessment. So about 25% of the counties have engaged in that support as well. So here's a map of the counties that have engaged with MAC in some capacity. The gray counties are counties that have asked a single question, maybe related to understanding the funds or understanding some of the legal aspects of the settlements, whereas the counties in green have had more engagement. So some of these counties have worked with me one time, some have worked with me and continue to work with me on a weekly basis. It just really looks different everywhere. But with 69 counties engaged, that's 83% of the 83 counties, which I think for a little over a year's time frame is really fantastic. Part of the support that I provide is to really think about administrative burden of these dollars and finding ways for local governments to reduce opioid settlement funds being used for administrative costs. So we've been able to create many templates and guidance documents and tools that are customizable. So we see contracts, RFPs, RFP scoring sheets, spend plan templates, resolution templates. So really anything folks can think of, we can create that and provide it in the original format to be customized at that local level. And we see a lot of this information being used around the country as well. We've also created a pretty extensive resource library. Our websites are updated, and the opioid settlement website is updated in real time. And so if there's ever a question of new settlements coming in, new resources that are coming out, we just put a new report that came out into our resource library and on our homepage this week. So it's always done in real time, so that way you all have access to that information as soon as we do. And then I would say that the most critical piece of support that MAC has provided to local governments was our release of our toolkit. So this is a guide for local spending that is a process document, and I'll walk you through the different aspects of it. But we had to really think through, what does it mean to create a document for 83 very different counties? And what are the processes that we want folks to really focus on, whether they have extensive capacity and a whole team to work on this, or whether someone is just trying to find the time within their regular schedule to work on settlements. So there's 4 key steps the document outlines. The first is stakeholder engagement. So recognizing that every community has local experts, thinking about if there's other counties or regional entities that folks want to engage with, ensuring that we're using an equity lens when figuring out who is coming to the table, which can mean a lot of different things, but we've especially pushed for individuals with lived experience to be at the table. So not just individuals that are identified as in recovery from a substance use disorder, but also individuals who are currently using drugs. And we just had a webinar on how to meaningfully engage with people with lived experience. So it looks really different on how this is being done. And I think we'll see an increase in engagement with those with lived experience over the next few months, especially. The second step was to really gather information. So assessing what local data is available. And we have a lot of access to data through many of the tools that have been created through University of Chicago, East Tennessee State University. They've put together some great tools, Duke. And then we also see, just because you have those stakeholders in the room, folks have been able to gather data from local treatment providers, other service providers, harm reduction agencies, recovery organizations, to really understand the specific gaps and needs in that local community, as well as the assets that are already there. The next step was really figuring out, is more of a capacity question, I would say. So do the folks in the room really want to move forward with development of a spend plan now? Do they want to move into a strategic planning phase? Do they have capacity for that? Is there an existing group that's been working in the community, like a task force or a coalition, that may have existing resources and tools to build from and capacity to continue carrying that out? Or is there a need for kind of taking a step back and trying to just create priorities to get an RFP out the door? So again, this looks really different in every single community. And this was kind of the most abstract of the steps. The last one here is reporting and evaluation. Actually, it's monitoring and accountability. My apologies. And so for the monitoring and accountability, we really looked at transparency as a key factor. And so where can folks provide opportunities for transparency? Is that from day one? Is that in how they look at things moving forward and providing opportunities for public comment in the future? And then thinking about, what does success really look like? Typically, the metrics that folks are going to be focused on are not how do we reduce overdose fatalities or non-fatal overdose, because this is just one of many funding sources. And the dollar amounts, while they sound large, spread out over 18 years, are not going to be able to address this crisis on their own. So being able to understand, what does success really look like? Is it about engagement? Is it about monitoring of the grantees if an RFP process was used? Figuring out how to assess those different pieces. So I also wanted to touch on just current trends in what I'm seeing. And we've seen the majority of counties create a steering committee. We have also seen, I think I spoke about the MSU technical assistance that's being provided, but we're starting to see more interest in evaluation support coming up as folks are either moving through the process and aiming to get dollars out the door, or as they have already started to do so. Now, at the local level, when we look at planning efforts, we see that who the leaders and decision makers are is different in every county. So at the end of the day, the decision makers will always be the Board of Commissioners. But when we look at who's really leading the efforts for planning for settlement funds, sometimes that's the county administrator, sometimes that's the health department, it may be community corrections, it may be a local coalition or a community foundation. It just looks different in every single county. And so whoever really has capacity to kind of provide that administrative support, was there funding for that administrative support, or does it need to be done with settlement dollars? And then I would say, the big question of where the funds are now, and that is that most communities have not yet spent funds. So there's been a really fine balance that every county really has to assess. And that balance is understanding the urgency of the drug overdose crisis, while also thinking critically about long-term planning and sustainable solutions with these funds. So the ability to formalize processes so that way in 18 years, when no one is in their job anymore, that there's a structure in place, that original vision of how these funds should be used really gets to the core of their planning efforts. And to really ensure that they don't fund programs for 1 year, 2 years, 3 years, and then have to cut that funding, potentially creating additional gaps in the system, potentially resulting in additional overdose, fatal or non-fatal. And then at the bottom here, I've provided some common themes of different strategies that counties have really been focusing on. These are not in every county, but I would say these are the most common ones that I'm hearing about in my day-to-day. So primary prevention, of course, and how upstream folks are looking really depends on that community and the existing prevention efforts. Stigma reduction around substance use in general, stigma reduction around harm reduction efforts, expansion of specialty court programming. So we're seeing creation of some recovery courts. We're also seeing just expansion of recovery courts. So maybe the program only served those that were facing a felony, and they want to include those that would be facing a misdemeanor. Or maybe the program only serves 5 individuals and they want it to serve 15. So we're seeing that take place. And as we talk about specialty courts and really any of these activities, we're really focusing on how do we look at the ecosystem. So if we expand one program, does that create a capacity issue for another program or another service? And really focusing on the continuum of care. While the state provides free naloxone, a lot of the counties are talking about how to amplify their naloxone distribution, addressing housing and transportation and other drivers of health. We are seeing a lot of recovery housing looked at, and I know transportation's come up in a lot of counties, but is of course a very complex issue to solve. And then again, a focus on coordination of care, linkage to care, warm handoffs, and expanding recovery supports. I think plenty of discussion around peer supports especially. So these are the resources that I wanted to provide. There's a lot more, but these I think are the key ones to really look at. At the bottom, you'll see there's a key agency kind of FAQ and then a regular FAQ. Probably 2 of the most helpful documents that have been created around the settlements. And then I did want to, as I get a little bit farther here, here's my contact information, but I do want to pull up Exhibit E to walk you all through that document as well. So I'm just gonna stop sharing the screen and pull up another screen for you. Okay, can we all see that okay? So the way that Exhibit E is laid out, there's Schedule A, the core strategies. And then if we scroll down, I'm sorry, this is probably making you a little nauseous. Then we have approved uses. So the core strategies are what are really considered the most evidence-based strategies. And then approved uses are also evidence-based strategies, but maybe less commonly evidence-based or people are less familiar. So we look at things like naloxone. We also look at a lot of treatment related to medication to treat opioid use disorder. And you'll see there's a lot of detail under some of these headings. And we do see special populations considered. So we see pregnant and parenting people. We see those involved in the criminal legal system. There's a lot to be observed in this document and a lot to consider. And there's plenty of duplication between the core strategy section and the approved uses section. But I will point out that with this document, what we see is a real focus on prevention, harm reduction, treatment, and recovery, and a real avoidance of items that are considered coercive or punitive. And I think those are really the key pieces. We've tried to arrest our way out of this problem for a long time, and we see that the overdose fatalities have really increased, And so being able to really try this other approach that really focuses more on getting these dollars to those most profoundly impacted. Now, I also want to jump to the last section here. So we see a treatment section. I'm so sorry to be scrolling like this. Let me just at least make it a little more zoomed out for you. So I need to get all the way to the bottom. Okay, so we have this other strategies category. We see support for first responders, and I really always want to highlight the two areas that are highlighted here. So supporting first responders in responding to overdose and addressing the secondary trauma associated with responding to overdose. So a focus on training and support. Then we see leadership planning and coordination. So I think this is one where we've seen a lot of interest, but maybe not a lot of active spending. But we do have a few counties that have expressed interest in having someone really lead and guide these efforts or work to combine data with other folks. We see that data and other infrastructure pieces are allowable with Exhibit E. We see training, research. We've seen some communities purchase vehicles to support transportation. We've seen some communities really look at how to even not use funds, but really focus on some of the items here. So looking at increased data sharing agreements within a community, looking at how to optimize or change software to really allow for integration of data. So there's a lot of opportunity within these funds, but I do want to point out that what is allowable in one county may not be allowable in another. What is allowable in one county may not be allowable within the cities and townships that are within that county. Every local government has their corporate counsel or their city attorney or their township attorney, and that attorney's interpretation of both Exhibit E and that definition of opioid remediation that I provided may differ. So what's allowable may also differ, which I think adds another level of complexity to the settlement landscape. So this is the website that I was referencing, and this is the dashboard on MAC's website, our Opioid Settlement Resource Center. At the top here, there's a drop down for folks to choose their county to be able to see the estimated amount of funds that are coming into their local government. This does not include any money that's coming into townships or cities within that county. These are county-specific funds. Up at the top here, you can see number of technical assistance requests, but the data that I mentioned that we'll be collecting will go into these 4 tabs here. The data that's currently in here was from our baseline assessment that we rolled out last spring. That was really to gauge readiness for spending. As you scroll down on the website, we do have this link here to the Attorney General's opioids webpage. On their page, they have a document called the Opioid Settlement Payment Estimator, which will allow you to look at the amount of money expected per year by settlement by local government or state government. And it does include a list of all of the townships and cities and their estimated dollar amounts as well. Here's a link to that state subdivision agreement that we went over a little bit and Exhibit E, the document we just reviewed. And then if you scroll down, we have the toolkit that I referenced as well as those template documents. And then the resource library, those webinars that I mentioned are at the bottom of the page. The resource library is split into different categories. And there's a lot here. I tried to create what could have been a succinct resource, but was unable to leave things out. And so if there's anything that you're trying to find, I'm happy to just pull a list of resources together for you. But really appreciate you all taking the time to listen to this today. I'm really excited about the work in this space, and especially to see what's going to happen over the next year, especially. as we're about a little over a year into this process, and I think we'll start seeing more action in the near future.
Amy, we do have one question. Terry was wondering if the website will contain some sharing of best practices across the counties.
So we won't be having information that is specific to what each of the counties are doing at this point. We are trying to provide that information in aggregate, but in terms of general best practice, we do see that there's a best practice kind of section in the resource library, but we also have a partnership with the Opioid Advisory Commission to highlight local governments. And so that information is just starting to come in, where folks are able to nominate their local government for representation in an Opioid Advisory Commission quarterly bulletin. And then we're able to potentially share that information with the National Association of Counties, as well as Johns Hopkins Bloomberg School of Public Health. And so we will see some counties highlighted, but it's really up to them whether they would like to be highlighted or not.
Thanks, Amy. Any other questions for Amy? Right. Well, Amy, thank you again for being here today. And we wish you all the best with your surgery next week. And thank you everyone for being here. Please stay tuned to more events coming up with MHAM. We also have very affordable memberships available to you as well. So you can check out future events at mha-mi.com/events. And we hope to see you all next time. Please look out for the survey that I will be sending here in the next half hour. Thank you, everyone, and have a great rest of your day. Stay warm.